Let us pray. Dear Lord, we just thank you for this opportunity to hear presenters enlighten all of us about faith, health, and justice issue. We thank you, God, for our presenter tonight, Dr. Harold Dean Trulear. This is my prayer in Jesus' name. Amen. We thank all of you for joining in to hear our lecture series. The faculty persons that have um, been presenting it came from Payne Theological Seminary and Howard School of Divinity. Just to share uh, the lectures that have gone forth in October, we had Black Theopraxis, Theological Education on Health and Justice, and the presenter was Dr. John Kinney. In November, we had Global and Social Solidarity. I presented that particular lecture. In December, we had a lecture on faith, trauma, and healing. That was done by Dr. Rosalind Brookins, Payne Theological Seminary. In January, we had a lecture on faith-rooted health advocacy, and that was done by Reverend Sheila Cuffey and Reverend Sharita Williams. In February, we had a lecture on storytelling, research, and public witness. That was done by Reverend Sharita Williams. In March, we had a lecture on health, equity, and work, which was done by Dr. Barbara Fears from Howard University School of Divinity. April, we had a lecture series on community partnerships and coalitions. And that was done by Dr. John Robinson from Metropolitan AME Church in Washington, D.C. And tonight, we are blessed to have our lecture tonight, Healing Ministries and Wellness Programs by Dr. Harold Dean Trulear. Dr. Trulear has served as an associate professor of applied theology at Howard since 2003. He currently teaches ministry and social justice, advocacy, ethics and politics, ministry and criminal justice, and church and community studies. He is a certified instructor in the Inside Out Prisoner Exchange Program, having taught HUSD, having taught Howard courses in several correctional facilities. Prior to joining Howard, he served as visiting distinguished professor of religion and public policy at the Templeton Honors College at Eastern University. He also held faculty positions at Yale, Colgate Rochester, the Center for Urban Theological Studies, Geneva College, and Jersey City State College. His administrative experience includes Dean for First Professional Programs at New York Theological Seminary, Vice President for Faith-Based Initiatives at Public-Private Ventures. He also served as pastor of churches in Pennsylvania and New Jersey, and he is currently a pastoral associate at Empowered Ministries International in Clinton, Maryland. Dr. Trulear has lectured for universities, church, and professional organizations across the country, including Fuller Theological Seminary, Rice University, Baylor University, Tuskegee University, Southern University, Payne Theological Seminary, Princeton University, the American Baptist Churches USA, the Mount Sinai Holy Church of America, InterVarsity Christian Fellowship, the North American Association of Christians in Social Work, and the NAACP. He is a Phi Beta Kappa graduate of Morehouse. He completed his PhD with distinction at Drew University. Dr. Trulear has authored over 100 articles, books, chapters, essays, and published sermons. His important monographs include Faith-Based Initiatives with High-Risk Youth, the African American Church and Welfare Reform, and George Kelsey, Unsung Hero. He directs a national research and demonstration project called Healing Communities, mobilizing congregations to support those returning from incarceration through the establishment of family and social support networks. With Charles Lewis and W. Wilson Good, he is co-authored of the book Ministry with Prisoners and Families, The Way Forward, The Way Forward. Through his research and activism, he has been named a fellow at the Center for Public Justice in Annapolis, Maryland, and served as a consultant to the Faith and Families portfolio of the Annie E. From 2013 to 2016, he served as a member of the executive session on community corrections at the Kennedy School of Government at Harvard University. In March 2017, he was named Justice Champion of the Month by the Coalition for Public Safety. He is also a member of the 2017 Leading with Conviction Fellows of Just Leadership USA. We are so proud to have him as our lecturer tonight, Dr. Trulear.
Thank you, Dr. Holly. It is a privilege to be with you all tonight in this ongoing partnership between Payne Theological Seminary and Howard University as part of the GIFT Collaborative. I was pleased to serve as an adjunct at Payne from 2006 to 2022, and that is prominent in my remembrance of the work that God has assigned to my hands. And so I thank you for the opportunity to bridge that gap once again. And I thank Ms. Dolores Brisbane for her leadership in the GIFT Collaborative and all of the schools that are supporting these efforts for us to work together. Because indeed, I believe we are called to the kingdom at such a time as this. I'm going to share my screen. Let's see here. I have to change the view. There we go. All right, is everyone able to see?
Yes, sir.
Yes, sir. Okay, great. So the topic is healing and wellness ministries in the church. I like to call it the ministry of seeing, because in dealing with health and wellness, a core theological principle for me is seeing the imago Dei in all human beings, seeing all people created in the image of God, and seeing what God's will is for their life. In the Pentecostal tradition, we may call that discernment. It's spiritual seeing. And so in the ministry of seeing, we need to have the capacity to see who it is in our congregations and communities, not just in terms of how they present themselves, but in terms of their internal conditions, both mentally and physically. The scripture that has been suggested for tonight as a backdrop comes from Mark chapter 2. A few days later, when Jesus again entered Capernaum, the people heard that he had come home. They gathered in such numbers, large numbers, that there was no room left, not even outside the door, and he preached to them. Some men came, bringing to him a paralyzed man carried by four of them. Since they could not get him to Jesus because of the crowd, they made an opening in the roof above Jesus. And my slide messed up here, I see. When Jesus saw their faith, he said to them, "Paralyzed man, son, your sins are forgiven." Now, some teachers of the law were sitting there thinking to themselves, "Why does this fellow talk like that? He's blaspheming. Who can forgive sins but God alone?" Immediately, Jesus knew in his spirit that this was what they were thinking in their hearts. And he said to them, "Why are you thinking these things?" And I asked the question when I taught this text at our church, how did Jesus know his spirit? It was a matter of discernment that Jesus used in understanding what was going on in both the hearts of those who doubted, but also in the hearts of those who brought the paralyzed man to him. Immediately, Jesus knew in his spirit that this was what they were thinking in their hearts. And he said to them, "Why are you thinking these things? Which is easier to say to the paralyzed man, 'Your sins are forgiven,' or 'Get up and take up your mat and walk'? But I want you to know that the Son of Man has authority on earth to forgive sins." So he said to the man, "I tell you, get up, take your mat, and go home." He got up, took his mat, and walked out in full view of them all. This amazed everyone, and they praised God, saying, "We have never seen anything like this." What strikes me about this passage is that Jesus focuses not only on the physical healing, but the spiritual healing. And then for those of us that tend to focus solely on the spiritual healing, he also focuses on the physical healing, because Jesus deals with us in terms of mind, body, and soul. To that end, our churches have to be the safe spaces that lower people down through the roof into the presence of God. They have to be relational. The four men that brought the paralyzed man to Jesus had a relationship. They had to work together. There was an act of restoration and healing, and Jesus operated out of discernment and also prophetically, because he brought healing to a poor man. And one of the things that I think we have to think about, especially in this new season of the third wave of Pentecostalism, which goes beyond the Pentecostal churches and the charismatic churches to all of our denominational traditions, how the gift of healing is also prophetic. The gift of healing is not just simply an act of mercy, but it's also prophetic, because, and I talk about this in a book chapter I wrote on the Black church and public policy, retrospect and prospect. The gift of healing is a prophetic witness because it is given without discrimination to social location or social economic status. We live in a society where healing is made available to people based on their insurance, based on their socioeconomic status, based on their access to health care, based on their financial situation, based on their access to mental health professionals. All of their access is determined by socioeconomic status. God's healing does not depend on socioeconomic status. God's healing does not depend upon race or neighborhood or access. God's healing is democratic in nature and does not discriminate based on whether or not people have access. So that when we talk about justice, we also have to talk about healing as a matter of prophetic witness, in that God has called us to heal the sick and to advocate for the healing of the sick who don't have access. You've all heard the saying, if you feed a man to fish, you feed him for a day. If you teach a man to fish, you teach him for a lifetime. But Louis Cortez in Philadelphia asked to that, but only if he has access to the water. Sit with that for a second. If I teach you how to fish, but you don't have access to the water, it doesn't matter. If I teach you how to fish, but you can't read well enough to pass the test to get your fishing license. If I teach you how to fish, but there's no public transportation to take you to the water. If I teach you how to fish, but you don't make enough money to buy a fishing rod. If I teach you how to fish, but you're not allowed to have access to a fishing license because you have a criminal record. If I teach you how to fish, but you have to work 4 jobs just to feed your family, you don't have time to go to the water, then it doesn't matter that I've taught you how to fish. Justice is a matter of access. And so in providing ministries of healing, both in terms of getting people to health professionals and also in terms of praying for the sick and believing God for miraculous healings, we are providing access and we are doing acts of justice, because it is not the will of God that healing be confined just to people who have the financial or the horizontal resources. One of the areas that we will talk about today is mental health. We'll talk about it in terms of chronic mental health issues, but we will also talk about issues of stigma and shame as mental health issues. We'll talk about how to think about these things theologically. What does it mean to develop a church competency, and how do we network? I know that that was the topic last week, but I always try to make sure that we don't fall into the trap of believing that the church can meet all the needs of a person, right? We say that all the time, that we are supposed to be in the need meeting business. But I like to cite Jude Tiersma in his book, God So Loved the City. If need controls your ministry, then need becomes an idol. If need controls your ministry, then need becomes an idol. it's much more faithful to be discerning as to where God would put me as opposed to just going out and meeting needs. Need can never be the controlling factor in ministry. And so we have to identify partners, and that's what the last session was about, identifying partners that can help us with this work. We already partner, the church already partners with the undertaker for the funeral. We partner with hospitals when people get sick. When I visit the sick, I do not change bedpans. I partner with the orderlies, right? And so in thinking about mental health, as well as the other conditions, we want to be talking about networking. I want to suggest to you that in our congregations, we have people who are dealing with grief, stigma, and shame because of health situations, because of the stigma we attach to sickness. Attaching stigma to sickness is nothing new. In John chapter 9, the disciples asked Jesus, Lord, who sinned that this man would be born blind, him or his parents? We're always trying to attach some sort of stigma or shame to illness, whether it be physical illness or mental illness or addiction, which are the three areas that we'll be touching on in this presentation. We have to be able to see people, see beyond the labels of addicts, see beyond the labels of cancer, see beyond the labels of schizophrenia. I am not my diagnosis. For example, I have two mental illnesses. I have two mental illnesses. I have PTSD and I have alcoholism. I do not identify as an alcoholic because that's a label, but I do struggle with alcoholism. That has been a lifelong struggle of mine. I am in a 12-step program. I am in Celebrate Recovery. I am in counseling, right? I am sober today by the grace of God and the fellowship of the 12-step program. And one of the things that makes the 12-step program work, and I'll talk about a little bit later, is it challenges us to see people as they are. The Zulu greeting, Sawubone. I see you. It's interesting in our culture, we always ask the question, how you doing? Now we really don't want to know, do we? Right? That's just become a standard greeting. How you doing? Oh, I'm fine. Well, in the 12-step movement, we say that FINE is an acronym. It stands for fouled up, insecure, neurotic, and emotional. Um, we're really not fine, but we tell people we're fine because we don't want to know. We don't want to see people dealing with their mental illness, dealing with their alcoholism, dealing with their PTSD, dealing with their cancer. We end up being in denial. And in the 12-step, when we say denial is an acronym, it stands for don't even know I am lying, right? So that critical to healing and wellness ministry is the capacity to see people who may have conditions but are not defined by their conditions. I am a cancer survivor, but I am not defined by my cancer. I am an alcoholism survivor, but I am not defined by my alcoholism. I am a PTSD struggler. I was not in the armed service. If any of you saw the movie Lean on Me, I was the chaplain at Eastside High School when Joe Clark was the principal. So that was the combat that I saw, and so I deal with medication as a result of that. But I am not defined by my disease. Ministry to those who are struggling with illness, addiction, alcoholism, mental illness should never be defined by their label. They need spaces that are physically safe, that are emotionally safe, that are socially safe, and cognitively safe. Is your church a place where a person can safely say that they have AIDS, that they have HIV? Is it a safe space where they can say, I'm struggling with addiction and I need help, I need my church? Is it a safe space where we can bring our various forms of mental illnesses that impact us? Or are those places that lack the trust that is necessary for people to self-disclose their health conditions? In his book, Trust, Francis Fukuyama says that African Americans have the lowest trust capital of any ethnic group in the United States. He tells us an interesting story. He says some of his white conservative colleagues get upset when Black people like Al Sharpton say you should buy from other Black people. Fukuyama says, I have a different question. I want to know, why does he have to tell them? Jews buy from Jews, Koreans buy from Koreans, other ethnic groups trade within themselves. And the answer, Fukuyama says, is that the experience of slavery has destroyed trust in our society, in African American society, to the point where we don't trade with one another. We don't trust one another because we have been taught a form of self-hatred through slavery and discrimination that makes it difficult for us to trust. And so when there is low trust, we have to present ourselves as being worthy of that trust, because where there is low trust, there is also high loyalty. And so healing ministries have to be relational. They have to be spaces where people trust us to pray with them, trust us to take them to the doctor, trust us to bring doctors and health professionals and mental health professionals into our congregations. When trust is broken by a protector, and many Blacks have developed distrust of the health system because of ways in which we have been misserved by it, there's a sense of betrayal that makes it difficult for us to provide healing. And so as churches, we can be intermediaries between the healthcare systems, physical health and mental health. We can be intermediaries between the recovery community and those struggling with addictions to help rebuild the trust that's necessary for people to get the services that they need. COVID, I call the great exposer, because the crisis of COVID really exposed fractures that were already present in our society. And Barbara Holmes talks about this in her writing on spirituality during the COVID era. We saw a rise in alcoholism. We saw a rise in addiction. We saw a rise in abuse. We saw a rise in violence. We saw a rise in divorce. We saw a rise in public health issues when COVID came. Why? Because COVID separated people. COVID separated people and exposed the fractures that were already present in our society. And for African Americans, that was even more difficult, because not only do we suffer from COVID-19, but also COVID-16-19, dealing with white supremacy as religion, state-sponsored violence, mass incarceration, economic apartheid, and housing shortages. So all of these things work against healthy communities, work against the trust that's necessary to bring people into wholeness. All of these things are part of that which fractures the spirit, soul, and the body. Stigma is one of the things that we attach to mental illness and alcoholism, for example, and addiction. Emil Durkheim says, imagine a society of saints, a perfect cloister of exemplary individuals. Crimes or deviance properly so called will there be unknown, but faults which appear venial to the layman will there create the same scandal that the ordinary offense does in ordinary consciousnesses. If then this society has the power to judge and punish, it will define these acts as criminal or deviant and will treat them as such. What Durkheim is saying is, we like to make scapegoats. We like to stigmatize people. I stigmatize you so I feel better about myself. And so it's very easy for us to stigmatize the addict, stigmatize the alcoholic, stigmatize the person with a mental illness, and thereby feel better about ourselves, but also alienate them from care, alienate them from community, stigmatize the person with the physical disability, and alienate them from community. In the book of Mark, when Jesus heals the man with the withered hand, there are two amazing moves that Jesus makes. Right? And I wrote about this in an article I did on the Black church and disability 30 years ago. When the man with the withered hand in the synagogue is presented to Jesus, the first thing Jesus does is he brings this man with his physical disability into the middle of the community. He doesn't heal him over on the side. He brings him into the center of the community so that the healing is a community event. The second thing he does is he tells the man to stretch forth his hand. In other words, he recognizes the moral agency of the man with the withered hand and bids him to participate in his own healing. He's not an object. He's a subject. And we tend to look at the sick as objects. We tend to label them in terms of their illness, label them in terms of their addiction, label them in terms of their alcoholism, but they have to participate in their own healing. And in order for them to do that, we have to recognize their moral agency. And that's difficult to do when they've been stigmatized. And so we have to move beyond the stigma that goes along with mental illness, alcoholism, chronic illness, addiction, so that we can see the people. I see you, Sawubone. Unclean, part of stigma. There's a scary tendency you find across nations, across cultures, religions, centuries, and social classes. It's called coalitionary aggression. There's this tendency of human beings who form the groups to then find some minority within their in-group whom the majority begins to bully, pick on, or marginalize. The majority calls itself clean, and they call this minority unclean. I believe we do that with people with illnesses and addictions. The majority is acceptable, the minority is unacceptable. The majority is normal, the minority is queer, odd, or different. The majority eventually creates a kind of coalition aggression against the minority, and in so doing, they make themselves feel good, and they unite themselves because they've now created a common enemy close at hand. We do this with people with disabilities. We do this with people with chronic illnesses. I was a pastor of a church. I won't say which one it was. It was a church that was built in the 19th century, and the entrance, excuse me, the first floor was a half a floor above ground level, and the basement was a half a floor below ground level. So I went to the board and I said, our church is not handicap accessible. We need to build ramps, right? And the answer was, so I'm not telling you the name of the church. The answer was, well, Pastor, we don't have any disabled people here, so we don't need any ramps. Talk about things they don't teach you in seminary, right? Well, maybe we don't have any people with disabilities here because they can't get in. So anyway, they did build a ramp. This is marvelous. This is marvelous. You can't make this stuff up. Any of you who have pastored, you know this stuff is real. So they put in a chair lift to get you from the ground floor into the sanctuary. But to save money, they didn't put a chair lift from the ground floor to the basement, and the bathrooms were in the basement. So you could now worship at our church, but you couldn't pee. Unclean. Unclean. Failure to see the humanity. Another issue that we have to think about is the grief that's associated with illness and addiction. We usually look at grief as something that happens when someone dies. But if you have a person in your family with a chronic illness, or a person who's been injured in an accident and um, they've lost use of their limbs, or they've been paralyzed, or they've been blinded, there's a sense of grief that the family has, to which we ought to be ministering. And we call it disenfranchised grief because it's grief that's not credited. We don't think that persons have the right to grieve over certain things. There's no validation. When somebody dies, we validate the grief. Why? How, rather? We have funerals, we have wakes, we have all kinds of events. We go and visit. But when somebody has a family member that they've lost to addiction, they're out in the street somewhere addicted, or they're home but they're not home because they're alcoholic and they're never emotionally present, there's a form of grief that the family has that needs to be recognized as well. Many who struggle with addiction also struggle with shame. The word shame that's translated shame in the Hebrew comes from the concept to cover or to be uncovered. Notice that in the book of Genesis, it says that the man and the woman were naked and ashamed, that the two go together. And so people who are struggling with addiction feel uncovered. They feel unworthy. They feel like they don't belong. One of the things that's really powerful about the 12-step movement is they spend a lot of time talking about a sense of belonging. That's why they have so many meetings. There's always somewhere to go. In his book, Addiction and Virtue, Professor Worthington at Texas A&M talks about how the 12-step movement provides more availability for belonging and fellowship than the church does. That you can go to an AA meeting or an NA meeting or a Celebrate Recovery meeting any day of the week. When you go for the first time, you get people's phone numbers. They give you a long list of phone numbers so you can always call somebody. Um, they're at the meetings. They ask who's anybody here for the first time, and they have a saying that the newcomer is the most important person in the room. And so there's welcoming is a part, and it's not that they have ushers. Like we have ushers that welcome you, or an announcement that welcomes you. In an AA or NA meeting, a good one, everyone will welcome you. Everyone will acknowledge your presence. And so belonging and a sense of worth is a critical component of the 12-step movement. If they're filled with a sense of guilt because guilt says I did something wrong, but worse than that is shame, because shame is not that I did something wrong. Shame is there's something wrong with me. Hagar named God the God who sees me, El Roi. In dealing with people's grief, we have to find the words, we have to help people find the words to talk about their grief, give them space to say the words, and let them know that their words are heard. And I mentioned earlier the Imago Dei. I'm going to move beyond that so we can have some discussion. I'm going to stop in a second for a break. Okay, so 3 areas. The first one is mental health. We have to destigmatize mental health. Depression is real. Trauma is real. We have to give people a sense of worth, recognize their sense of worth as part of suicide prevention. There's a Bible verse that I'm sure most of you know. In Psalm 139, David says, I am fearfully and wonderfully made, and that my soul knoweth right well. How many of us in our churches do not know that, do not know well that we are fearfully and wonderfully? See, the Imago Dei says you're fearfully and wonderfully made, whether you know it or not. The church's role is to help people to know it, to know that they're fearfully and wonderfully made, to know that there is hope for them with regards to trauma, to know that there is help for them with regards to depression. Partnering with mental health professionals, just like we partner with the funeral director, just like we partner with the doctor. I'm part of an initiative in Detroit right now called Be Healed, where we are trying to develop community-based mental health resources for Black males in the city of Detroit. Destigmatizing mental health care profession, destigmatizing the mental health profession, and working with Black men to help them have safe spaces where they can talk about things that are bothering them. One of the initiatives that Be Healed is working with is called the Papa Was Initiative. And that comes from the song Papa Was a Rolling Stone. Led by a group of Detroit musicians, they play R&B music as part of group therapy, getting Black men to talk about their mental health issues and talk about relationship building. Of course, most of us in seminary are trained to offer pastoral care and referrals, and also to offer prayer. So I'm going to stop there before we move to chronic illness and see if there's any questions or comments. I know there may be some things in the chat. Okay. I don't see any hands yet. So,
There's nothing in the chat yet, Dr.
oh,
Trulear.
okay. Okay. All right. Thank you.
Mm-hmm.
All right. Well, I will go back to sharing then. Okay. Like I'm stuck. Chronic illness. Now, this is a place where we can provide support groups for people who are dealing with illness. We can pray for their healing, and God does heal sometimes miraculously. I know my wife, who is my pastor, spent 2 years in a wheelchair. She was told she would never walk again after an automobile accident, but the Lord miraculously healed her. And I shudder when I look at churches who've become so rationalistic and so scientific that we lose sight of mystery and awe and wonder and the supernatural. I think it's a critical component that's missing in our churches. Um, there are people who are being cured miraculously of diabetes, of hypertension, and cancer. But then there are also people who are being cured medically. And a critical component of what we can do is be supportive of them um, in dealing with chronic conditions such as diabetes, chronic conditions such as hypertension, chronic conditions such as cancer. Um, there is um, there is a lot of research that has gone on in the last 20 years also around something that is being called post-traumatic slavery disorder. Post-traumatic slavery disorder. And basically, what that argues is that slavery created a certain amount of stress hormones in the body that was unaddressed through therapeutic and healing means during slavery, and that the stress hormones are passed on from mother to child during pregnancy, creating unnatural levels of stress baselines, cortisol as baselines in the bodies of African Americans, and that many of the diseases that we deal with, specifically hypertension, specifically diabetes, are in some ways related to the fact that we have higher levels of stress in our bodies. And so what part of what needs to happen is we need to provide space for people to de-stress. And I don't know about you, but that's why I don't pastor anymore. Because that was stress. Um, but my point is that if we're not providing space for people to de-stress, and we're making the church a place where stress is increased, we're building on top of already stressed bodies. Um, my doctoral student, Gigi Kanyesi, just wrote a marvelous DMin thesis on post-traumatic slave disorder and churches as places of healing for African Americans and other people of color, using some of the work of Riesman Menachem, Fred Hinkling in Jamaica, and others who have studied stress levels and trauma in the African American community and the ways in which trauma impacts us differently. And you've already had a session on that, so I won't go into detail about how it impacts us differently. We can provide the space in our congregations through support groups for people who are dealing with these chronic illnesses and chronic conditions. And I would add to the list that you all gave me from pain, which I appreciate, uh, physical disabilities as well, because physical disabilities are chronic illnesses, and there are things that we tend to overlook. I wrote a book chapter um, some years ago on the Black church and disability. It's in a book called Disability in the uh, Human Disability and the Service of God, edited by Nancy Easland. And I talked about how even in churches that minister to those who have physical disabilities, we don't see people with physical disabilities as ministers. Let me say that again. Even churches that minister to people with physical disabilities don't see them as ministers. Would you call a blind pastor? Would you call a pastor with a hearing disorder? I'm going to do a quick experiment here. I'm going to stop sharing for a second. Can I get the grid? Can I get the full grid? Okay. Now, if you can look at if those of you that aren't driving, okay, if you can look at this picture, all these pictures, not everybody's real picture, but I'm just going to go with the pictures that I see. I see 1, 2, 3, 4, 5, 6 people with physical disabilities on the screen. What am I counting? Glasses. That's right, Dr. Brisbane. I'm counting glasses. But watch this. Nobody sees me as disabled because I wear glasses. If I had a hearing aid or if I was working with crutches, right? But eyeglasses, you're having a sight disability that where you need to be corrected because for corrected lenses. Not only is it not stigmatized, but now it's a fashion statement. You have folks, you know, people that wear glasses that don't need them. They wear contacts and don't need them so they can color their eyes. Right? Glasses are a designer statement. My glasses cost more than my suits. We've turned a disability into a fashion statement. We possess the capacity to destigmatize disability. And every time you see somebody wearing a $1,500 pair of glasses, these didn't cost $1,500, but some of y'all got some $1,500 pair of glasses. Every time you see a $1,500 pair of glasses, what you are demonstrating is the capacity to destigmatize a physical handicap. So we have that capacity. We don't stigmatize people with glasses. I had a colleague who taught Bible at a seminary, and he had polio as a child and walked with crutches. But he did something very interesting. He had wooden crutches. He didn't have those metal braces that go around the arm. He had the wooden crutches. And when we asked him, well, why do you have the wooden crutches? He said, because when people see the wooden crutches, they think I hurt myself. If they see the metal crutches, they'll think there's something wrong with me. So I use wooden crutches so people just think I hurt myself. I'm a normal person who hurt myself because they will stigmatize me if they think that I'm crippled. So I include physical disabilities under chronic illnesses because of the stigma factor and because we tend not to look at them as being part of healing ministries. Nutrition and fitness programs. One of our DMin students just did his DMin thesis this past year on developing health and fitness programs in churches, in his church in particular. We have to deal with things like obesity and diet. We can form these in our congregations. You can have church health fairs, bring in medical professionals and mental health professionals as well to destigmatize going to the doctor. And then addiction. I want to show a clip.
Scientists first began to understand addiction as a brain disorder in the 1950s. Doctors Olds and Milner, in laboratory studies of rats, found the parts of the brain affected by addiction. But then in 1994, doctors Volkov and Shelbert, top neuroscientists, ran CAT scans of the brain that showed the effects of substance use disorders. Like other diseases, these scans showed it affected tissue function. There are two main parts of the brain affected by drug use: the limbic system and the cortex. The limbic system, located deep within the brain, is responsible for our basic survival instincts. So when you do essential things to stay alive, like eat, drink, find shelter, have sex, or care for your young, your brain reinforces behaviors that cause the release of dopamine from this region. That reward for surviving is also transmitted to the amygdala and hippocampus, which records a memory of that feeling, so we seek it again. This is our survival hardwiring. Addiction also affects this area, up here, in the prefrontal cortex, which is what separates us from other animals. This is where decision-making and impulse control live. When drugs or alcohol are used, they activate the same dopamine process in the survival center. And when use is repeated, that substance can hijack that part of the brain. This hijacker changes the brain and weakens this system to make it believe that the primary need for survival is the drug. In hijacking the brain, it can usurp those primary motivations: food, water, shelter, sex, and protecting our young. And the hijacker needs more and more of the substance to activate the same level of reward or feeling of pleasure, causing the brain tissue to become increasingly damaged with continued drug use. There are factors that put you at higher risk for the hijacker, including individual factors like genes and age of first use, and then environmental factors like drug availability. But if the hijacker takes hold, addiction is treatable. Advancements have been made in assessments, detox, treatment programs, recovery supports, and medications to treat addiction. Brain scans show that once in recovery, the tissue in the limbic system and cortex can get better. With your help, we can expand these innovations to help millions of individuals and families and ensure that addiction is treated as the medical issue that it is.
Let me stop there, see if there are any comments. Because most churches treat addiction as sin and not as an illness.
Dr. Trulear, this is Dolores Brisbane. I have a question.
Yes, ma'am.
I think everything you've said since I've been a healthcare professional for over 75 years is accurate and true in every line. What I would be interested in knowing is, how do we change the theological curriculum that prepares people for the pulpit to be prepared to address the issues that you have discussed and are in our congregations? Because the work of the Gift Collaborative is convergence between theological education and practice in the congregation. So what information or what thoughts would you have that would help us get there?
I think that what we have to do is to work as hard in exegeting the human condition as we do in exegeting texts, scriptural texts. In other words, when you consider the whole of theological knowledge, right? All the doctrines and history and exegetical work, the fundamental question is, how do you connect it to the people? And so for me, that doesn't start, and I know this may sound heretical to some people, this doesn't start with scripture as much as it starts with knowing where people are and knowing what they're dealing with. When I taught at New York Theological Seminary, we had a concept in our curriculum where we talked about trajectories. So that when we taught church history, what we would do is we would start with, what is the current state of the church in New York City, where we're located, with the Protestant community whom we're serving. And then let's go back and see what we need to know in church history to help me understand what is here today. So if I go to look at a community and I see there's addiction, and I see that there's mental illness, and I see that there's chronic illness, and I see that there's lack of access to health care, those kinds of issues ought to control how I deliver the theological curriculum, right? So that it's not so much that I'm following the needs, but I'm recognizing the reality of what people are going through and what people are dealing with, right? Um, I do community organizing. One of the units in my justice class at Howard is community organizing, where we get people into a room to get them talking about what's going on in their communities so that the pastors and the religious leaders can respond to where the people are, as opposed to parachuting in as experts and delivering theological knowledge. So I think every seminary should have a sociologist. I'm a trained sociologist. Every seminary should have a sociologist on faculty. Every seminary ought to teach people how to exegete a community. And then say, now, if this is the situation that we're facing, what is the theological curriculum, right? So that in my own work in mental health, right, I want to know what's going on with regards to the mental health of African Americans, and then then raise the theological questions that address them, rather than start off with what is Christology. Now, my other area, some of you know this, is criminal justice. So I want to know what is the condition of people who are dealing with the criminal justice system, and then I formulate my theological questions based on what they're dealing with. But it's a community organizer's perspective on theological education. It builds from the ground up. Tom Skinner wrote a book years ago called "If Jesus is the Answer, What Are the Questions?" So I think that our curricula really require more listening to what's going on the ground. And I don't think we're trained that way in graduate schools. We're just not. And I can say for myself, for example, I don't teach a single course I took in grad school. What I'm presenting tonight, I did not learn in grad school.
Well, I'm sure you didn't,
No,
because when we ask alumni of these schools what they needed, they said all that we did not learn in seminary,
yeah,
because they graduated not prepared to lead a church. I won't say manage a church, but lead a church based on what was going on with the congregation. So I guess my second question is, because you say what I agree with you. So do you think that that should be a required course uh, in the seminaries?
oh yeah, I do. I think that every seminary should have a course on church and community, understanding communities, understanding how institutions work, understanding the interplay between faith and politics, faith and economics, faith and poverty. Um, and that um, when I was dean at New York Seminary, one of the things we did was we actually would pair practitioners in the fields with academic theologians to team teach courses on things like HIV, AIDS, community organizing. Um, we're a professional school. We are professional schools. We're not graduate schools of religion. We're professional schools. Now, at Howard, we have to debate that a little bit because we are a university divinity school. But we're still a professional school. And so it's critical that we make sure that people have professional skills that can engage their communities. Robert Cuny's book, Things You Don't Learn in Seminary, argues that you learn 25% of what you need from ministry in seminary, 50% during your first 3 years after seminary, and 25% the rest of your career. And so I think we have to be more humble about what we can offer in 3 years and then give people trajectories so that they can continue in a lifelong journey of learning, which is part of what we're doing in forums like this.
Well, I appreciate that because data doesn't lie, usually. And we know from not just ourselves, but the church is on a banana peel, that enrollments are in the toilet, excuse my unladylike language. And so whatever it is we're supposed to be doing, we're not meeting need because it's not serving market. That's the business jargon. But as a Black woman who has been every place that any Black woman could go, and some places she should not have, the outcome of what you are saying is a call to do something differently than what we are doing now, because the evidence is it's not working. And so I would, in my time when I do nothing else, I think about how probably the Holy Spirit has guided us to do a lot of stuff that we may be able to do that other people couldn't do. So we're asking for that kind of advice from someone like yourself. Hi, I'm on a call. Can I call you back? Thank you. So that's really what I'm asking for, because you've given us such an outcome, a rich outcome. So how do we turn this around? If we prepare people to do it better, how do we do that preparation?
I think we have to do more listening.
Okay.
What is it that people in the pews are concerned about? We also have to divest ourselves of the notion that the Black church is the most important institution in the community. Bill Curtis gave our honors convocation address on Friday at Howard and astutely pointed out that the church is now the visiting team. His sermon was on somebody needs to preach in Athens. And his point was that when Paul preached in Athens, he wasn't preaching to empty folk. He was preaching to folks who were full of other stuff, full of other philosophies. We are no longer preaching to people who are empty. We're preaching to people who are full of other philosophies, of other theologies, of other ideas. We have competition now. There are high schools practice on Sundays. I mean, it's people have choices, right? The church is no longer the center. We have to stop pretending, Curtis said, that we're the home team. We're the visiting team now. We are at odds with the culture. And so there really needs to be, here's my thing, Dr. Brisbane. When we send people to Africa, China, right, as missionaries, what do? We have them study the culture. They have the missions courses, right? They study the culture. They study the language. We have an assumption in theological education that we already know our culture. So we don't need to study it. I submit that we don't know it.
I agree.
I submit that we don't know the patterns. We don't know the rhythms. There's a book that I require my students to read in the social justice class at Howard, The Contemporary Black Church, The New Dynamics of African American Religion by Jason Shelton. No Black seminarian should graduate without reading this book. The Contemporary Black Church by James Shelton. He says that what we're dealing with in the Black community is what he calls the third great disestablishment. And the first great disestablishment was the separation of church and state in the Constitution. The second great disestablishment was the secularization movement in white America. And the third great disestablishment is the dechurchification of the Black community. And if you look at, oh gosh, the woman at Yale, I'm blanking on her name right now. The Spirituality of Young African Americans is the name of the book. Wright, that's her last name, Almeda Wright at Yale. If you look at her book, what she'll tell us is that young African Americans are socially conscious and spiritual, but they don't see them as part of the same thing. Their spirituality is over here and their justice commitment is over there. They don't think God is concerned about justice. They do justice as Black Lives Matters, and then they do we fall down, but we get up in 99 verses of having done all to stand. Okay? So their faith is personal and has nothing to do with justice, and their justice commitments have nothing to do with their faith. That's the disestablishment that Shelton's talking about. And so we need to be studying what's happening in our own communities, right? The graying of our congregations, all the stuff in the 80s we said would never happen to Black folk when the white church was dying. Back in the 80s, I'm 71 years old, so I've been around. I've been around a couple months. You got a couple months on me, Dr. Brisbane, but I have been around, right? Back in the 80s, we all
maybe
talked
22 years on you.
Yeah, 22. Yeah,
I'm 93.
I let
And
you tell it.
one of the reasons that I raised that question is at least Lamont Johnson heard me say earlier today, I am tired of people talking. And I'm very tired of people studying. I am ready to take this work forward as action. So my questions to you is for that reason. I'm a pretty learned old girl, but I'm tired of people talking, writing, and not serving people as they need, because the Gospels I read, Jesus touched people and healed them, and he did something for them, and he did it when he was talking to them. He didn't go back and ask his father to give him another book. He was prepared to do what he had to do. So this list that you have given is significantly long. So how do we start addressing that by creating programmatic focus and leadership that makes that happen? So you don't have to answer that, but think about it. I'll call you up.
Yeah, you can call me up because
I'll call you up and we'll talk about it more,
yeah.
Because our work is focused on the now. And we do follow everybody's data, some people's data that we shouldn't follow, but we do look at it in comparison with our own. What our own young people have told us is that they have lost faith in the organized church, that they haven't lost their faith, and they haven't given up on the faith of their, they said, grandmothers and parents. In several months of conversation with them in community, their advice to us was that the organized church does not work for them. So we've got to look at that in our focus of programming. I will say to you that the next iteration of the Gift Collaborative will be a model of leadership that trains people to respond to the needs of people. Because I'm a nurse undergraduate, and we didn't get to study. Once you put that cap on your head and got a job, you had to respond to people right then. That was so long ago, you wouldn't want me to practice on you now. But in any case, that's the basic understanding. All right, so the Gift Collaborative has been developed along the response to need perspective. And we were encouraged or are encouraged by the work that the docs and some theologians did in North Carolina with very glowing outcomes. But it was just a stick. So we know that if we go into a congregation and put the resources into it, people's health status is changed. We're preventers. So how do we broaden that as we go forth with the next grant? That's really what I'm fascinated by, to hear from you, because all of the stuff you say, I know is the truth because I've lived it.
Mm-hmm.
And so what I'm interested in is, if the seminary isn't training people to address that, how do we change that?
I think a lot of it is through continuing education. It's through creating new types of doctoral programs that create new kinds of scholars. And what I'm doing at Howard is, we've got the Black Congregations Resource Center. We're going to be spending a lot of time working on these kinds of issues as a stopgap until the curricula change. I mean, I don't know how long it's going to take, or how many seminaries are going to have to close or sell their campuses before people recognize that they ain't buying what we selling. All over the country. I mean, and this is not a Black seminary. This is Gordon Conwell and Trinity Evangelical, two of the major white evangelical seminaries. Gordon Conwell sold their campus and Trinity closed.
Yep.
So, this is a church-wide problem. And the largest seminary in the country is Liberty. Jerry Falwell's. He's got 4,000 students.
We know it well.
So
because they're recruiting our people, or trying to.
Yep. And because they give them access. It's access.
Yep.
So I care about criminal justice because I have a criminal record. Okay. I did time.
Right.
I care about addiction because I'm in recovery.
Right.
And one of the things that I've discovered, and I is that a lot of students, once they find out that I've got that, that I'm in recovery, and I'm not talking about how, I'm talking about every school I've ever been to, every school I've ever taught. You heard the list earlier, but Dr. Holly read it. They come and talk to me about addiction issues. Somebody in jail. I've had students break down and cry because their parents were in jail, and this is the first time they've been able to talk about it in a religious context. There are, so we get now, I get students every year now in the D-Min program at Howard who have criminal records, and they're coming to Howard because I teach there. And because they know that there's somebody in theological education who is not ashamed to talk about his past, is not stigmatizing folks like that, and is trying to find some answers to the problems of mass incarceration, the problems of unjust criminal legal policy, etc. So, there's got to be a, my interest is piqued by the fact that I've been in those spaces.
Yep.
And so
you know the journey, and so you're trying to make it better for others.
That's it. So
yeah. So that's why I was asking for your advice, because I'm known to tell people you can't go where you haven't been very well. And that's so right. That kind of applies to everything. And let me say to you, that's my frustration. We have too many people trying to go where they haven't been, and it's become an academic journey. And I'm going to do something about that. So that's why I'm asking you what it is. So thank you for that. I don't want to dominate the conversation, but I really wanted to ask that question after looking at the list of issues that are common They aren't unique now. Thank you.
Surely. For how many view that the idea that addiction is a disease is new information? Is that because most churches I'm in, they consider it to be sin. But what the video I showed you demonstrates is that in the mind of the addict, because it attacks the limbic system, which is the system that in which our survival instincts are rooted. People literally have their brains have literally been hijacked to believe that if they don't drink, they'll die. If they don't use, they'll die. And getting people hooked on crack. Now, this is pre-fentanyl. I mean, fentanyl makes all this crap dangerous, right? But let me, since we're all grown, why would someone get hooked on crack? When a person has an orgasm, we're all grown. When a person has an orgasm, it releases 200 units of dopamine in the brain. That's that good feeling you get in an orgasm. 200 units of dopamine. When a person smokes crack, it releases somewhere between 1,000 and 1,200 units of dopamine. In other words, a hit on a crack pipe is 6 times as pleasurable as an orgasm. And you wonder why the crack dealer gives you your first rock free. I got people with medical backgrounds on here, so I'm not they'll correct me if I'm wrong. 6 times the intensity of an orgasm for 30 seconds. And you tell me, and you wonder why people get hooked on that stuff. And you saw in the video how it becomes so powerful because it's so much more intense than the good feeling you get from eating, or the good feeling you get from sex, or the good feeling you get from, I don't know, watching your favorite television show, right? Or the good feeling you get from smoking a cigarette. Cigarette releases 250 units of dopamine, but it just does it over a longer period of time. It's not as intense as an orgasm, or as definitely not as crack cocaine. And so the brain gets tricked into thinking that it has to have it. Now, there's 2 things that are true. One is I can't keep stigmatizing these folks as being sinners. I have to look at the disease model. And the second thing is, if I believe in healing, I've got to look at both the medical and the spiritual aspects. I believe in deliverance. I go to 12-step meetings, but I also go to a Pentecostal church that lays hands and casts out spirits. I don't see where there has to be a difference between, I don't see where there has to be an either or. It's interesting, in addiction studies, one of the things we know that when a person gets clean and sober, their brain memorizes where they left off. And if they stay clean and sober for a year, 2 years, 10 years, the brain has still memorized that. And if you start back after 10 years, within 2 to 4 weeks, you will be right where you were when you left off, because your brain memorizes where you left off, even after 10, 15 years. Matthew 12, when a spirit comes out of a man. Y'all know that text, when a spirit comes out of a man. He goes out and he sees dry places. He says, I will go back to my place. And he sees the place swept clean, and he brings 7 more. It's the same thing. The medicine and the scripture line up. So yeah, I'm going to go to rehab, and I'm going to have somebody lay hands on me. I'm going to get the Vivitrol and the Earl. Y'all know what the Earl is, right? The Earl, Vivitrol and Earl. I want all of it because I want to be free. And I know that there are, why else would Paul say, be not drunk with wine, be filled with the Spirit? It's all about what controls you, right? So we have to have a complete shift in our understanding of addiction if the church is going to minister effective in that space. Any other questions or comments? It's only 7:15. I don't know how long you all normally go, Dr. Holly. You're on mute.
We'll go as long as you go, Doctor. Well, our time to end is 7:45.
Okay.
Yes. And I don't see any questions in the chat. I just see some statements, but no questions. Everybody's agreeing with you.
Wow. So you all are ahead of the curve. I see some of you I recognize. Some of my favorite pain students from when I was on the pain faculty.
Yes.
Let me say, hey, Reverend Cooper, how you doing?
Really good. Thank you. Good to see
Let me
you.
Good to see you. Let me say another quick word then about healthcare and justice that you probably would not have gotten in another setting. One of the places where we really need to be looking at healthcare is in the correctional systems. Most correctional systems are underserved by mental health professionals. The estimates are that close to half of all men who are incarcerated and 80% of all women who are incarcerated have need of psychotropic drugs. 80% of women that are incarcerated. The mental health issues of incarcerated populations are so severe that in at least two cities, Philadelphia and Chicago, the head of their local jail systems are clinicians, not cops. The Cook County jail system in Chicago is run by a psychiatrist. The Philadelphia County jail system is run by an LCSW. In cities like Los Angeles and New York, the largest mental health facilities are our county jails. And so there's a real need for mental health provision in those spaces. Also, in many jurisdictions, people have to pay copays when they're in prison.
Yeah, I was going to ask you to speak to that, Dr. Trulear, please.
Sure. And many of us, even those of us that worked in the system, weren't all aware of that until COVID hit and states started revoking it. And all of a sudden, you say, wait a minute. And you find out my home state, Pennsylvania, to go to the doctor, a prisoner has to pay a $5 copay. Now, when you're working a prison job that pays you 10, 15 cents an hour, $5 copay is how many days' wage? That's a week's wages. Can you imagine paying a week's wages for a copay? And if you don't have that, then your family's got to send it in. And so we saw that system exposed during COVID when many states suspended the rules and people said, wait a minute, you mean you're making these people pay for their health care? And so there needs to be a movement to get rid of copays in prison because you can't pay somebody 15 cents an hour for a prison job and then charge them $5 for a copay. Another healthcare issue in prison is hospice. Louisiana was one of the first states to provide hospice care. They actually train residents of the prisons to provide hospice care for other prison residents. I try to avoid using the term inmates because in Louisiana, and many prisoners die while they are incarcerated because the sentences are so long. So Angola prison has its own cemetery because the average sentence of a person who is in Angola prison in Louisiana is 60 years. That's the average sentence, not including lifers.
Dr. Trulear, there's a question here.
Okay.
How do we battle those spaces when the jails get the money but are continually challenged to cut the services? Or on so much spent on an inmate and complex cases are ignored?
Jails do what they do because they do it out of sight. And for me, the answer is you make visible how they're treating people, right? You visit, you keep your eyes on them. You make sure they see what you're doing. You hold up the mirror. They get away with things in criminal justice policy in large measure, number one, because it's done out of sight. The second reason is what my colleague Keisha Middlemass, who teaches poli-sci here at Howard, calls propaganda. Propaganda. And what she means by propaganda is in the Black community, we are handed law and order as the only way to solve crime, right? There's a book that was written by James Foreman Jr. called Locking Up Our Own, which is a study of Black attitudes in Washington, D.C. toward crime. And what Foreman argues is that Black people are tougher on crime than Republicans. But part of that is because it's not just our proximity to it in our poorer neighborhoods, but it's because we've been told that the only way to solve the problem is with police, not with jobs, not with better schools, not with better conditions. It's with police. And so when something goes wrong, our knee-jerk reaction is police. Watch this. Give you two examples of knee-jerk. How many of you remember about 15 years ago, there was a policeman in the school. They call them school resource officers, right? To make it sound nice. There was a police officer in the middle school who was called into a classroom because a 12-year-old would not give up her cell phone.
Mm-hmm.
Some of you remember that.
Mm-hmm.
And he actually ended up throwing her out of her chair to get the cell phone away from her. Okay. You can look it up if you don't remember that, you can look it up. It made national news. I called a friend of mine who is a pastor, an AME pastor, and a police officer, and a school resource officer, because I was getting ready to go public and blast the guy. You know, that's police brutality. And the pastor said to me, he said, Doc, you know, what the guy did was wrong, but here's the question you're missing. Why did the principal send for a cop to discipline a kid over a cell phone? That's not a crime. We want police to do everything. And so the girl won't give up her cell phone, call the cops. Come on. You don't call cops for that. In fact, he said, I've been kicked out of schools by principals because I won't do that stuff. They'll call my captain and say, your officer won't go take a kid's cell phone or won't tell a kid to be quiet. That's not their job. That's not a policeman's job, but we want the police to do everything. So we have a responsibility, right? We are responsible in part for police brutality because we call the police for everything. Around the corner from Howard Divinity School, there's a Days Inn. And there was a party in the Days Inn 3 years ago. And at the party, there was a shooting and somebody got killed. There's an interview one of the ladies from the neighborhood. Oh, we need more. That's why we need more police. Wait. What do you mean we need more police? The party's in the hotel. You're going to have cops up and down the hall? A policeman wouldn't have stopped that. But we make police the answer to everything. And so we have to train ourselves and our own communities to advocate for other types of solution to the problems of criminalized behaviors. Because one of the reasons that the jails can do what they do is that we have, and I'm talking about African Americans now, we have bought into the culture of revenge that has been handed to us. T. Richard Snyder, Protestant Ethic and the Spirit of Punishment. Revenge is the air we breathe in American culture. And so when you hear somebody say, we're going to bring them to justice, that means retributive justice. We're going to get them. I'm going to get you, sucker. And that's our culture. So Jails can get away with that because that's the dominant ethos of the culture. We have to change the culture. We have to balance justice with mercy. We have to make our systems more human. When you get a chance, go on YouTube and look at prisons in Norway. And you'll see there are other ways to do prison. They wear their own clothes. They have keys to their cells. They're deprived of their liberty. That's the deprivation. But then they teach them how to live. How do you want somebody to come home? That's the question they ask. How do you want these people to come home? You want them to come home bitter or better? So those are two things. Those are two things. Changing the culture of revenge and exposing the practices for what they are and the lack of human consideration. And Dr. Green, your class transformed my ministry. Thank you, Dr. Green. She's one of my favorite people, Dr. Renita Marie Green, one of my favorite people. Irene Wade has a question.
Yes, good evening. Thank you for this discussion. Very enlightening. One of the things that came up earlier in in the questioning was about action, turning our, what we know into action. Can you speak to how you feel community development corporations can play a role in helping churches to become more active in their communities?
Yes. Community development corporations are there to help shift the agency of the community from the outside to the inside. In other words, a good community development corporation is one that speaks for the community itself. One of our problems as preachers and religious leaders is we parachute in as experts and then start a community development corporation to fix the things that we think are wrong with the community. When the true nature of a community development corporation always has the interest of the community at the center. So that, for example, what's the number one complaint that community people have about a local church? It's not that you're not doing something about the drug problem. It's not that you're doing something about the education problem. The number one complaint they have is that you're taking all our parking spaces. So how are you going to build a partnership with folks that already don't like you because they go shopping on Sunday and they come back, they got to park 3 blocks from home? Right? So community development corporations start with building relationships with people in the community, since your church is probably a commuter church. Because most churches are now commuter churches because we have horizontal mobility, right? So you start building relationships with people in the community, and the corporation comes out of that, right? Friend of mine, lifelong friend of mine, a guy named Buster Sorey, some of you probably know him. He took over First Baptist Church of Somerset in 1990, became the pastor. And one of the things that they did was they had he said, we're going to invite the community to help us develop a community development corporation. And the church people said, but it's our church. We should develop the community development corporation. He said, no, it's got to be part of the community. It's their community. We don't live here. He said, if somebody breaks into one of our cars, it's their police department that shows up. If the church catches on fire, it's their fire department that shows up. We're using their water, their electricity. So, we need their input. So they brought the community people over, and community people said, first thing we would like you all to do is we thank you for the turkeys at Thanksgiving, but we think you ought to let us choose who gets the turkeys. And the church folks said, what do you mean? There are turkeys. And they said, well, but you don't know who we are. You give them turkeys to a lot of folk that don't need them. In fact, a lot of folk come over here and get the free turkeys and then trade them for crack. We've got a turkey crack economy going on here in the projects. And you all are part of the turkey crack economy. So the first thing about a community development corporation is that it has to represent the interests of the community. You need community people. It's not your board doing nice things, your CDC doing nice things for people in the neighborhood. To be a true CDC, it's got to be representative of the community. The second thing is community development corporations thrive in attracting funds that can't go into a church. There's certain people that will not give money to a church, but they'll give to a CDC. It's really a partnering organization. And a church has to have a certain amount of trust in the CDC leadership to be a bridge between the community and the church. You can't if your church controls your CDC, then it's not really a CDC, unless everybody in your church lives in the neighborhood, which it probably doesn't. And I used to do work with a group called the Christian Community Development Association. It was run by John Perkins and Wayne Gordon out of Chicago and Mississippi. I don't know if CCDA is still doing work, but they're closely aligned with community development corporations, our community organizing strategies. And one of the things that we do at Howard is there's a required unit in our social justice class on community organizing. I bring community organizers in to do community organizing training and strategic messaging training, which is also important. Strategic messaging is how do you message justice in a way that mobilizes people. And we use the formula, the VPSA formula. Lead with values, present the problem as a threat to the values, then a solution to the problem, and a realizable action, VPSA. The civil rights movement didn't just happen, they had strategy. Today, y'all just want to march. We all go down to the White House and march. What do you want? Justice. What kind of justice? I had a student skip my class. He said he couldn't take off work to come to my summer school class on social justice. And then I go on his Facebook page the next week and he's down at the White House. I know I'm missing work, but I got to be down there for my people. Dude, you don't even know what you're doing down there at the White House. Get your butt back in my classroom. You marching because you saw somebody march on television. Got to have a strategy. King had strategy. He trained. He trained at the Highlander School. There's a structure. The Satyagraha formula that Gandhi had. All that stuff. That's social justice ministry is an art. And I had a colleague at one seminary, said, "Well, we don't need a required course in social justice. We all do social justice. So we don't need a required course." I said, "Well, we all use the Bible, so let's stop requiring New Testament." That's why I don't get promoted, y'all. Because I say stuff like that. Gotta have a strategy. And healthcare is an area. In the article I wrote on the Black Church and Public Policy, I single out 3 specific supernatural gifts of the Spirit that are political. One is the gift of healing, because the gift of healing says God does not heal based on your socioeconomic development. So when we lay hands on the sick, especially in poor neighborhoods, we are judging a system that doesn't provide health care for poor people. The second is the gift of tongues. The gift of tongues is prophetic because it says all human language is under judgment. If tongues is a heavenly language, then human culture can never be perfect. And the hegemony of white supremacy can never be placed upon any religious tradition, because culture is nothing but organized language and organized meaning, and that meaning falls short of the heavenly language, which is why God gives us the gift of tongues to speak in the heavenly language, uncorrupted. by human cultural forms. And the third is the gift of knowledge, the gifts of knowledge and wisdom, supernatural gifts of knowledge and wisdom. Why? Because God wants to give people wisdom and knowledge that they can't get access to because they can't afford to go to seminary, or they can't afford to go to Harvard, or they can't afford to go to Howard. Um, you know, I'm all for seminary education, but I also know that God, as long as we put seminary education out of reach financially, or we put medical education out of reach financially, or we don't train people in elementary school and high school to be qualified to go to the schools that they need to go to, God can drop that knowledge into somebody supernaturally. I'm not saying bypass school, but what I'm saying is we have an education system that's tied to socioeconomic location, so that the gift of knowledge and the gift of wisdom says God can bypass your socioeconomically determined education system and make anybody smart. So I believe that there is a social. I submitted that to a Pentecostal journal. They didn't want to hear that. They want to hear that. They just want to, But it's all of that. It's supernatural healing, supernatural gifts remind us who's really in charge. And I don't want to do seminary without the supernatural.
This is Lamont Johnson. If I can just jump in and say how I really have been enjoying this, but particularly this last movement, um, because there's an idea oftentimes in theological education that the gifts of the Spirit in operation in the church is something that has ceased. And this is a new view of how spiritual gifts operate within the academy, connecting to the church, but at the ultimate, growing and impacting the community, for which all of us should be focused on. So this is rich, Dr. Trulear. This is rich.
Thank you, Brother Johnson. You know, when I teach the social justice class, I do a unit on territorial spirits, believe it or not. But because I believe that I believe in principalities and powers. Walter Wink wrote about it in Theological Education 40 years ago. I believe that take a city like Boston, you've got a spirit of intellectualism, because there you get Harvard, MIT, right? New York, there's a spirit of economic oppression. It's the marketplace of the world. Here in Washington, you got the spirit of political power operating. Philadelphia, my hometown, spirit of independence and isolation that comes out of its Quaker founding. And my favorite city, and this is not because I'm an Eagles fan, but my favorite city is Dallas, because Dallas has a spirit, and it has a spirit of arrogance and independence. And it was born. Let me tell you something about Dallas. I went down to do some work in Dallas, and the people said to me, now, when you talk to the preachers, you cannot tell us that we have problems. So what do you mean we tell you that? He said, Dallas, you can't talk about problems in Dallas. Dallas doesn't have problems. It has challenges. And so I'm sitting there saying, wait a minute. He says, yeah. He said, this is the only, listen to this. This is deep. This is deep. Dallas is the only major city in America that was not built on a body of water. Dallas was not built on a lake, was not built on an ocean, was not built on a river. Philadelphia's built on a river, New York's a port, Baltimore's a port, LA's a port, Chicago's on Lake Michigan, Houston's on. Every major city in America was built on water except Dallas. They built a city in the middle of nowhere and brought the water in, which is proof to them. So it's in their DNA that we can do anything. We have challenges. And that's why Dallas is so arrogant. And I remember the next day, I'm doing my morning walk, and I go past this place called Dealey Plaza. Some of y'all know what Dealey Plaza is. That's where Kennedy was shot. There's a monument on the grass at Dealey Plaza, and the monument has a plaque. And the plaque says on November 22nd, 1963, a significant event in American history occurred in this place. That's it. They won't even admit that Kennedy was shot there. Right? Because it's in their DNA. That's a spirit. That's a spirit. And if you're going to do ministry in a city, you need to know its spirit, and you need to develop spiritual warfare against the spirit of that city. We don't teach that stuff in seminary. Whenever I go to a community, I always read the history of the community because I want to know what's going on. Similar in Montgomery, yeah. Know the city's history, the history of slavery in the city. Perth Amboy, New Jersey was a major slave port. And they had to do when Donald Hilliard built his church, they had to do a lot of intercessory stuff in that space. Somebody asked me to do a quick commercial about the Healing Communities Ministry. One of the things that we do, Healing Communities USA, is a nonprofit that I organize that trains churches to do reentry and work with families of those who are incarcerated and coming home. And you can go on the website and look at our material. We've got textbooks. I taught a lot of that material when I was actually teaching in the master's program at Payne back in the 2000s. And then we had a DMIN unit organized around restorative justice that just graduated. Was it 2 years ago, Dean Holly? Dr. Holly, I think it was 2 years ago that group graduated. And some of them are doing some tremendous stuff. We actually were able to do a continuing education thing based on those DMIN projects down in Iberville, Mississippi. Two of our paying DMIN students, Davis and Dickey, did these really powerful DMIN projects down there, and working with reentry and creating church culture around carceral ministry in carceral spaces and reentry. Dr. Brisbane asked about changing curriculum. Here's something I would change about a curriculum. Every seminary I know has a pastoral care course, and they deal with pastoral care of the sick. I think they should have pastoral care for prisoners as well. They're in the same list in Matthew 25. Number one. Number two, there are over 2 million prison beds in America and only 984,000 hospital beds. So at any given time, there are more people in prison than in the hospital, but we train people to go to the hospital, but not the prison. And number three for us as African Americans, 1 out of every 3 African American males between the ages of 18 and 34 is currently under the supervision of the criminal justice system. 1/3 is either in prison, in jail, on probation or parole, or in a halfway house. 1/3. And Dr. Green and Dr. Cooper will tell you one of the things that I challenge pastors to do is give an altar call for families of the incarcerated in your church and break the silence. I've been doing it for 17 years and never had an empty altar. And the largest number of people to come forward was in 2015 at Bethel AME Church in Baltimore. Before Bishop Reed was elected bishop, he had me come preach and do the workshop. And we had 400 people from Bethel come forward and say, I've got somebody locked up. So those are the things that I work on. Those are the things that I think that are important in ministry. And I'm grateful for the opportunity to share with this cohort, and to thank you to the Gift Collaborative, to Dr. Brisbane, to Dr. Holly, Ms. Commander. Yeah, I miss you all out there in 937 area code.
Thank you so much, Dr. Trulear. Dr. Nancy Brisbane is going to close us out.
Yes, thank you, Dr. Trulear, so much. Thank you, everyone, for participating. The video or recording of this will be available on the Gift Collaborative YouTube channel in a few days. Please feel free to take a visit and share it with anyone else you know who might be interested. As Dr. Holly said at the opening, this is the last in our series, and we're grateful for everyone who's participated and contributed. It's been a wonderful experience, and we wish you all a wonderful evening. Thank you.
Thank you.
Good night.
Good night.
Thank you, Dr. Trulear. Good